And welcome to Doer TV, another issue of My Insurance Sucks. Well, we hear every once in a while. My guest and really the host of the show, I just kind of show up and try to give a good introduction for Mark Roden. He is an expert in all things insurance, but we have been doing productions together for the last year or so, actually, in different capacities. Starting with a TV show where he was on the Business Spotlight, great show, talking about the changes that were coming and the ways that you could afford the Obamacare or Affordable Care Act, however you say it in your universe. But today we're going to be talking about some changes that some of the larger insurance companies in the country, i.e. Blue Cross Blue Shield, they've got some big changes, don't they, Mark?
Yes, sir. Thanks again, Patrick. You're awesome. So we normally just give out good information here, and we'll continue to do that, but we kind of have some breaking news. Blue Cross Blue Shield in the state of Texas announced last week that they are actually going to terminate all plans that are non-grandfathered. So what that means is if you purchased a health plan from Blue Cross Blue Shield and it was after March 23rd, 2010, that's when the Obamacare PPACA law was passed, then that plan will be terminated by the end of the year. Now, I'm not picking on Blue Cross Blue Shield. They are just following the law. As it was written, originally, this was supposed to happen. And last year, the government decided to kick the can down the road, if you will, and delay that to 2015. So in today's show, what I'd like to do is notify everyone. Unless you bought a plan that is grandfathered, this is going to eventually affect you. But yes, right now, I've got hundreds of clients that will be affected by this, and obviously tens of thousands, if not millions, of people will be affected by this decision.
Now, how did this come about? I mean, what's the history of this? Give me more information.
Okay. Well, the main thing is that the law, the PPACA, Affordable Care Act, Obamacare, basically said if you sell insurance, health insurance, it must have all these essential health benefits. It has to have maternity. It has to have drug rehab. It has to have ambulatory. It has to have all these free birth control, many essential health benefits. So obviously that thing's 2,400 pages long. We did a whole TV show on it. It's on the website if you want to review that. But basically, part of the law stated that all plans, it's a mandate. All plans by, like I said, originally it was 2014, but then they delayed it to 2015. All plans must comply with this unless they're grandfathered. And the definition of grandfathered is a plan that was in existence before that law was passed. So it goes all the way back to March 23rd, 2010. And you must also have not made any major changes, because if you make major changes, so I'm sure people back are saying, is my plan grandfathered? You would have to ask your insurance company that question. That's a biggie. So if you have a grandfathered plan, you don't have to worry about receiving this letter from any carrier because you're grandfathered.
Wow. So I guess I'm just trying to figure out, where do you want to take this show from here? Because I'm stuck. Where it sounds like a lot of people are going to be really hurt and angry.
Well, yes, and that's why we named the show "My Insurance Sucks." Hopefully, they're not going to say "My Insurance Agent Sucks," but yeah, I know it's hard to swallow. It's probably going to be received in a negative way. That's not what we're here today. We've got options, okay? There are good things about the Affordable Care Act. Here's a major good thing. Everyone is guaranteed issue now. So someone sitting there, oh my gosh, my plan's been canceled. Well, it just means you're going to have to go out and get a guaranteed issue plan. The other good news is that there are subsidies available. There are subsidies available for those who qualify, like we did a whole TV show on. Basically, it's going to be based on your household size, not the square footage, but the number of belly buttons you have in there, and also your gross income. It's complicated in the sense anyone's self-employed, it's actually monthly profit. It's on projection, which really confuses people. Again, it sounds like a redundant theme. You're going to have to talk to an expert. Talk to someone who wants to explain this slowly to you and where you understand every element. Of course, I'm Dave Ramsey's endorsed local provider in the Dallas market. As Dave would say, don't buy anything until you totally understand it. So it's a lot of news. It's a lot of chaos, if you will, in the marketplace. But there are solutions. There are options.
Now, aren't there also some things with discount cards and things that you have used in the past and recommended?
Yes, I'm glad you mentioned that. There are non-insurance solutions out there. A lot of people are spending money on dental insurance, and they're not really utilizing it. Well, there's a discount dental plan that you can purchase, and it's not. Some of my clients, and if you're watching this, I'm not saying this is a bad, but some of these premiums for a full family can be $128, $150 a month. Maybe they have perfect teeth and they just need it for the cleanings. Well, there are alternatives, non-insurance alternatives that could reduce that maybe down to $25 or $29.99. Pick your plan. But yeah, there are non-insurance solutions. The name of that product is NC2 Rewards. It is on the website. It's a great way to kind of look at everything and see if that might be a benefit to your family.
So it's NC2 Rewards, is that what you said?
Yes, that is at myinsurancesucks.com, as well as the TV show that we did, Patrick, and also any form, if you will, web form, if you need any help on anything insurance, really. There's a form there. Just fill it out. We can connect like we are here over the computer, or we can meet, or we can talk on the phone. Just lots of changes out there, but don't be disgruntled. There are actually solutions. And for those who are not affected by this initial letter, I would just urge you to look at and plan for, unless you qualify for subsidies, you're probably going to see a premium increase, because there's no way you can cover everyone with guaranteed issue, cover maternity, drug rehab, all that without the premiums going up. So again, not getting any political donkeys and elephants discussion. We're just talking about solutions today, and there are plenty of them out there. It's just get with someone who has your best interest at heart, that can walk you through the process, and that's about it.
Well, one last question. As far as the subsidies and things, Mark, can you help people find out if they qualify for the subsidies?
I'm glad you said that. Let me get to my screen here. One of the ways that we look at subsidies, can you see that, Patrick?
I can.
Okay, so this right here is kind of a cheat sheet that I developed. Of course, this is the number of belly buttons in your house, the number of family members, and then this is the gross income. And let's just take an example of a family of 4 that is making about $40,000 a year. This is not their subsidy. This is actually the amount that the projected amount this family will pay for a mid-level silver plan. All the new plans will have a metallic name, bronze, silver, gold, platinum. And so this family making $40,000 will pay around $160 for health insurance. I also say this is not just for poor people. Some of my people building businesses are not pulling in a lot of income. And then others, with larger families. I have 4 children. So my subsidies would actually go all the way up to $125,000 of gross income. So it's not just for poor people. It is an IRS vehicle. It's not like Medicaid or anything like that. So absolutely make sure that you talk that cares and that can walk you through that process.
Excellent. Well, the visibility of the numbers was not very good. So I did see when I looked closer that the top gray part was Medicaid, and it looked like that went up to about 8 belly buttons and 50 grand, and then the lower part was unsubsidized, and that was stair stepping down. The more you made, the more you paid.
Yeah, I have a tool. I'll make sure it's on the website that you can just plug in and play around with. And there's some people, it's on a projection of all things. So someone who's self-employed, they're not going to know what they're going to make in 2015. So we would have to project it. I would just encourage, yes, you can go to healthcare.gov and go direct, but it's not costing you any more money to use an expert. The insurance companies pay our premium, or your premiums pay our commission. So you're only cheating yourself if you go direct, so to speak. And there are, as in last year, we had a little bit of difficulty. Expect some more glitches, as they say. So someone that's done hundreds of them should be able to help you out a little bit better than just calling somebody on a 1-800 number.
Well, I totally agree. Again, Mark, any closing words for today?
No, I just appreciate your help, Patrick, in getting the word out. I know this information can kind of be a little bit overwhelming. Just take a deep breath. It'll be okay. And hopefully we can put you in a better situation. If not us, someone else that has your best interest at heart. Put you in a better situation, and it's all good.
Thanks so much, Mark. We'll talk to you guys next week.